Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today I'm chatting with Dr. Sushma Malik. Welcome, Dr. Sushma.
Thank you, Christine.
It's so wonderful to have you here. You are, of course, one of our presenters for the Gold Lactation Online Conference coming up here on April 1st. We get started with our keynote presentation, and your presentation is titled, as part of the conference, is titled Anomalies of Breast Appearance, Not a Barrier to Breastfeeding. I'm very excited about that topic. But before we jump into that, tell us a little bit about yourself. Where in the world are you? And tell us a bit about your work.
Thank you, Christine, and thank you for this opportunity to share my journey with this team. I'm a pediatrician and a neonatologist and have been a lactation consultant with over 3 decades of experience in addressing the challenges of neonatal, reducing neonatal and infant mortality and working with breastfeeding dyads in Mumbai in India. I've been a professor emeritus and a head of the Department of Pediatrics and Neonatology in one of the India's largest public health hospitals, which was a multi-speciality hospital in Mumbai. And I closely worked with people with different and diverse socioeconomic backgrounds, with cultural backgrounds, and different linguistic and religious backgrounds. I'm also a national assessor for Baby Friendly Hospital Initiative and have been a senior faculty and training for breastfeeding and the IBCLC program. This has helped me to spread the message of breastfeeding, of IYCN practices, both in the community as well as in the urban and rural slums and areas. Currently, I'm also the board director of ILCA and the president of Breastfeeding Promotion Network of India, Maharashtra. I'm also, fortunately, the National Expert Advisor for National Neonatology Forum of India. All these platforms have really helped me to widen the message of breastfeeding at the grassroots levels and in the urban areas. I'm looking forward to, interacting with the Gold Conference participants and to share my experiences in dealing with mother-baby dyads.
And we're looking forward to learning from you, Dr. Sushma, on this very important topic. Yeah, you were the one who brought that topic to us about breast anomalies and breast appearance and breastfeeding. And when we saw that topic that you suggested, we thought, wow, this is so interesting. We would like you to present on this. So my question is, how often do you see this in your practice in India?
Sorry,
how often do you see these anomalies in breast appearance in India? Or, must be something that, is happening or you see frequently.
Yes.
So you want to educate others about it as well.
Definitely. In my years of practice, I've come across several cases where there have been anomalies in the breast appearance. And, there are multiple causes for these, anomalies. And it depends on, if you say that how many cases do you see, it all depends on what is the cause or the etiology of the anomaly causing the physical appearance, be it infections, be it dermatological conditions. It could be post surgery, it could be post burns. All this will really change the incidence and the prevalence of these anomalies. But roughly, I would say, putting all of them, we would definitely come across at least one case per month, but with different etiologies. So that's a huge amount of mothers who could be facing, these conditions.
Yes, and you mentioned some of the conditions like burns, like infections, autoimmune diseases, and such. And I can imagine that it is a very challenging situation for these women and families because they, of course, are worried. Am I able to breastfeed with such a condition, right? And the IBCLC and lactation care providers have to be really trained in this topic so they can really assist best the families they're serving, right?
True, true.
So tell me some of the challenges that you see with conditions like that for breastfeeding.
So the basic challenges is that most of the mothers, if it is infections and all, they are not aware that
Mhm.
how long they have to be separated from their baby. They don't know the actual transmission, that how it will occur. And, some of them have their own cultural beliefs, and they may still want to when, it is really avoidable in those situations, at least temporarily. So the biggest challenge is the lack of ignorance, the lack of support, the deep rooted cultural beliefs of such mothers, and their families. And for us in India, the family support is the biggest thing. And so a daughter-in-law or a daughter has to listen to everyone who's at
Mm.
home. So I think that is one of another challenge that is there.
Absolutely. And I can also imagine great mental health challenges as well for the
Absolutely.
woman experiencing this and fearing, of course they want the best for their baby. They want breast to breastfeed
Yes.
and give human milk and that might be something they're really concerned, worried about and feel, the impact on their mental health as well on
Yes.
this, right? You are, of course, you are also a professor. You wear so many hats. You work in the clinic, you work as in neonatology and IBCLC with families. You see, as you mentioned, multicultural, in a multicultural background there. And you are also, as I mentioned, a professor. So you're looking at research. What kind of, is there a lot of research available on that topic, or have you encountered huge research gaps?
There are a huge amount of literature that is present, and there are clear guidelines for almost everything. But on the other hand, for example, when COVID came,
Mhm.
at least, the literature wasn't available, but fortunately, it never caused any anomalies. The other challenges are when there are no clear guidelines, whether it is for HIV or TB, or for that matter, even in chickenpox, when their appearance, the physical appearance on the breast can get altered with number of lesions that are there. But whatever literature is there, it could help us out. So overall, we have found that there is literature, and few conditions there are gray areas where we try and adapt from, whether it's from WHO, whether it's from UNICEF and our National Neonatology Forum, as well as other forums that help us out for such conditions.
Wonderful to hear. Thank you so much for that. Now, before I let you go, Dr. Sushma, what are you hoping our viewers will learn from this presentation?
Well, I hope that my viewers and the participants can learn these simple ways of identifying such conditions, as well as helping us for not only early identification, but referrals to the medical team, and then appropriately counseling them, telling them simple ways of overcoming the barriers, be it with positioning, be it with temporarily helping them with alternative modes of feeding.
Oh,
That's what
beautiful.
I would
Thank
want
you.
them to learn.
Thank you so very much. It was such a pleasure having you here today and talking about the
Same here.
amazing work you do in your hospital, in your country there, and also for the presentation you have with us here at Gold.
Thank you. Thank you. It's been a pleasure talking to you, and I'm looking forward to a large audience attending it. Thank you.
And as I mentioned, this presentation is part of our Gold Lactation online conference of 2025. We got started April 1st with our open access keynote presentation that is available to everyone. Please check it out at goldlactation.com. You find all the information about all the presentations there. And our conference is live and recorded, so you can also watch the recordings at any time that is convenient to you. So I hope to see everyone at the conference. Thank you, everyone, for watching, and have a lovely rest of your day. Bye-bye, everyone.